Diabetes in pregnancy is a big problem concerning us, not just in this part of the world, in Asia, but also in Singapore. When we talk about diabetes in pregnancy, I'm not just referring to those women who already have diabetes and who are planning for pregnancy, but it also includes those who develop diabetes during pregnancy, what we call gestational diabetes. If we talk about diabetes in pregnancy, for women who have diabetes and are planning for pregnancy, they should have a serious conversation with their obstetrician to see if it is a good time to get pregnant with diabetes, because two things are very important. One is that the medicine that they may be on is not safe for pregnancy, and the other is that the sugar control has to be perfect for pregnancy. This is all to prevent harm from coming to the baby, because especially in the first trimester, in the first 12 weeks of pregnancy, baby is being formed, and if the medicine is unsafe or the sugars are high, this can lead to fetal abnormalities which can affect the heart, the spine and the brain. When we talk about gestational diabetes, we are talking about diabetes that happens in the late second trimester, usually about the 24th to 26 weeks of pregnancy. This is usually brought about by a family history of diabetes, getting on in maternal age. Usually the cutoff is about 40, being overweight before pregnancy, other factors like certain ethnic groups which are more prone to having gestational diabetes. Even though gestational diabetes comes on late in pregnancy, in the late second trimester, it can also harm both mother as well as baby, and there's both implications at present and also in the future. For the mother, it can lead to cesarean section, and a mother cannot deliver naturally. It can lead to big babies, what we call macrosomia, and the mother tries to deliver naturally. There will be obstructed labor, there will be birth injuries, and this can lead on to emergency Caesar. It can also lead to premature labor, and the worst case scenario is, of course, which we want to prevent, is loss of the baby. In order to prevent the complications of diabetes in pregnancy, if a woman has pre-existing diabetes, it is important to see the diabetes doctor as well as speak to their obstetrician as to when is a good timing to be pregnant. Important to change their medication to medication that is safe for pregnancy, and to make sure that their sugars are well controlled for pregnancy. For women who are fearful of gestational diabetes, developing diabetes later in pregnancy, they should watch their weight to ensure that if they are overweight, to lose weight before pregnancy, not to delay having babies, and to have babies at a younger age. In this way, you can reduce your risk for having diabetes in pregnancy and all the much feared complications that come with it.